Hello, Pamela. My name is Brooke. I'm your nurse today. Alright, I'm just gonna, before we get started, I'm gonna check your name band. So could you please tell me if this sounds correct? Pamela Protocol, date of birth, 11/21/1952. Does that sound correct? Okay, wonderful. I'll double check to make sure that's what the patient's chart says as well. And so, Pamela, so it looks like your O2 stats are a little low. I'm hearing some gurgling, and I'm seeing a little bit of drainage on your dressing. So what I'm thinking is that it might be a good time to suction. I looked in your chart, and you do have orders for suctioning. We're going to do it at about 120, level of about 120. So I'm going to turn that on and make sure that's right. And so, Pamela, what suctioning is going to do is help to clear some of the secretions that are in your lungs. Okay? So next thing I'm going to do is just take a look around, make sure I have all my emergency supplies. I have my arbitrator, the second trach, one size smaller, 12cc syringe. We have another breathing mask just in case. I have a mask for myself. The ambu bag is up there, as well as a scissor on the wall. And then a mask, as I said, a mask for myself. And so I'm going to demonstrate how to put this on, but for the sake of the video, I'm not going to leave it on. Okay, so, and I would keep that mask on for the remainder of the skills that I'm performing right now too, just because both of these skills can kind of lead to some spraying from the trachea, and that's something that you want to protect yourself from. So the next thing I'm going to do is make sure this is at a good reach so I don't have to turn away from my sterile field. Put it right there. The side of the bed rail is already down. Everything's at a good height for me. So next what I'm going to do is assess the patient's pain. So Pamela, do you have any pain? And she says no. If she did, I could provide pain medication beforehand to help just with the pain of that procedure and to make sure that that is more comfortable for the patient. Okay, so first I'm going to set up my sterile boat. Set that right there, get that out of my way. And I'm going to lift the saline, just make sure that any germs that could be on the end there are out. And then I'll pour that into my container. Okay. Next what I'm going to do is I'm actually going to flip this just because my gloves are on the bottom and it'll be a little bit easier for me to get at them. Okay. Very carefully opening that again. And just making sure that I'm only touching the glove bag and I'm grabbing that out. So we'll push this up a little bit. Just give me some space to work with my gloves. Alright, so Pamela, what we're going to do is I'm just going to finish setting up here, and then we're going to use a little tube that helps to suction out some of the gunk that's in your trachea right now, okay? And that's going to help you breathe a little bit better so that your O2 stats go up a little bit, and that'll be a good thing for you. Trying to very open this backwards. So what I'm going to do is grab from this side for this hand. Not the ideal angle, but I didn't want to risk flipping it and contaminating my field at all. So then this, get underneath there. Okay. Fixing the gloves. Alright, so that's on. Next I'm going to reach over here and I'm going to grab my suctioning tube. I did nick the bottom a little bit there, so I'm going to make sure not to touch the bottom of that. So both my hands are sterile at this point. This one is about to become just clean because I'm going to use it to attach the suctioning. So suctioning is attached. I'm going to test it in the water and just get a little bit of water on there to kind of help with lubrication. All right, so now her oxygen, I would have hyper-oxygenated to make sure that she had a good amount of that her lungs were at a good point, or that she had enough oxygen for when I do the procedure, because the suctioning can get in the way of that. So if she was at a 2, I'd probably turn it up to about a 4, probably double her oxygen saturation. So now, as I said, this hand is just clean, so I'm going to move the patient's mask out of the way. And I'm going to insert to about 7 centimeters since the patient's tracheostomy tube is about 6 centimeters, so I'm going to 7. Just that around the hand. I'm going to put the mask back on, and you want to wait 30 seconds between each suctioning to make sure that the patient has enough time to reoxygenate. Do that out again. Like I said, I'd wait 30 seconds. I'm going to go again. And in between suctionings is another good time. Another thing that patients can do is you can encourage them to cough and deep breathe, which is going to help to move more of those secretions out for them. Okay. Now I could do it a 3rd time. 3 is the most you can do, but this time I'm going to stop at 2 because it looks like the patient's O2 stats have gone up. I'm not hearing as much of that gurgling either. So I'm happy with the suctioning at this point, and I'm going to be done. How are you feeling, Pamela? Good. Are you feeling okay? Okay. Okay, so I'm going to take that glove off. This one I'm going to leave on for a moment because I do want to take the patient's, sorry, I do want to take the patient's inner cannula out at this point. So, or excuse me, the dressing, not the inner cannula. I'm taking something. Okay.
With the outer of this?
You can hear me? I'm just going to sneak that out there.
I don't know.
We're going to throw that away.
Like if I touch the outside of this thing?
Okay.
With my gloves on?
So, Pamela, I will be right back. I am going to leave you hyperoxygenating just for right now because I'm going to monk with your trachea a little bit more. And I'm going to go and get your the rest of the equipment to change your pad, okay? And to clean up around your site. Alrighty. So I want to flick the suctioning off so that's not needlessly running.
Oh wait, yeah.
Put this next to you, Pamela. This is going to be your new strap. We're changing that too. I'll have someone come in and help me in just a moment with that. So our cannula is taped a little funny due to being reused. Okay. So at this point I'm going to keep, just make sure I'm really careful with my sterile gauze and things. And one thing I did forget to mention is that you can actually use the suctioning that you used on the patient's oral pharynx as well. And that way it can help to kind of clean some of the gunk out of their mouths. A lot of times they will actually have their own suctioning right by their bed, so I would probably prefer to use that, but you could use the same suctioning system to suction out their oral pharynx. Next, I want to drop these on there. Okay, and next I'm going to don my sterile gloves. I'm going to move my arbitrator up here. I think that'll be okay, just so I have a little bit more room for my gloves. I'm being very careful not to touch my two hands and keep at least an inch in between them to keep that sterility.
Well, I just don't know like how if she's gonna.
Not the best shot of the glove, but I think we're still pretty sterile. Okay. So that's on. I'm just gonna throw that into the garbage. Okay. So we have sterile hands, and what I'm gonna do is make sure that I keep this hand sterile. However, this one is gonna kind of be the one moving the oxygen mask and things around. So I'm also gonna use this to remove the inner arbitrator right now. And the patient, like I said, is oxygenating. I'm gonna unclip this. Just pull your arbitrator out. Okay, that's going in the biohazard bag. Next to my clean hand, I'm going to insert the new one. Clip that on there. Good. Okay. So next what I want to do is get these things ready. And I forgot to pour my sterile water, so I would call an assistant to come and help pour my sterile water for me since I'm in the throes of getting everything ready. Sure. Sorry about that, Pamela.
That's okay.
She would lip it and then pour it.
Flip it and then pour it.
Awesome. Got that about halfway full. Okay. And that one got a little off the corner there, so I'm not going to use that one. Okay, so the mask I should put back on in between switching that and then putting that back on. So I'm going to make sure those are wet. And ready to go. And so I'm going to wash around, get any crusties off. I want to make sure to make only one pass, and I don't want to go, I want to make sure I'm going in to out, so I'm not bringing any of that gunk from the inside onto, but the inside is the most sterile, so I'm trying to go away from the sterile part.
So we aren't done.
And make sure that it has a face
Fix
shield.
well, maybe a little bit.
Where this the entire procedure when I'm done with the train. But I'm not going to do it.
I'm just going to clean it out again there. Okay, so I am okay without cleaning.